So gastro-esophageal reflux disease, as I said, is a chronic condition. It really affects the stomach and the esophagus. And it's understood really to be as a result of acid or bile coming up into the esophagus, which is the gullet, and staying around for at least over 5 or 6 sort of 10 minutes to cause the irritation. And I say 5 to 10 minutes because actually reflux is something that happens generally in most normal situations, but it's the sort of the frequency or indeed the duration that actually makes reflux sometimes a problem. So patients obviously experience it either when there's a bit of a problem with the valve, which is the barrier, or a hiatus hernia. And symptoms are classically heartburn. So you feel that burning sensation at the back of your breastbone, chest. Some people feel it coming up towards their neck, and some people in their ears, and also some patients the back between their shoulder blades. So it does come in a variety of different symptom patterns, but the important thing is obviously to note that you will note that staying upright can ease, and lying flat or after meals can make it worse. Now, there are sometimes that reflux or GERD can give you some rather atypical symptoms like chest pain, and there are a lot of patients do end up going to see their cardiologist worried about maybe possibly something wrong with the heart or the lungs, and it's not particularly unusual for it to be considered possibly a heart attack type symptom because it can actually even get to the left arm. But that isn't indeed the more common. Some patients get a lot of belching, a lot of nausea, can also be a symptom. And in the cases that have not just acid, but what we call volume reflux or quantity reflux, you do find regurgitation. So when you belch or burp, you sometimes find suddenly your mouth is full of maybe fluid or saliva or stuff you'd eaten before. And that can be quite uncomfortable, and particularly at night if you're lying flat. Occasionally coughing can happen in the middle of the night, and you end up with this, what we call aspiration sort of pneumonia. So these broad range of how the reflux or GERD can present. Now, unfortunately, in maybe untreated cases or when it's persistent, then you can get complications like inflammation, like esophagitis, which is really where the tissues are now getting angry. That makes usually the pain more persistent, particularly gnawing, and sometimes actually really feeling like a burn. And patients do end up having a lot of Gaviscon or milk. So that's really where things can get into difficulty. And then, of course, unfortunately, scarring can occur. And on the rare occasion, or less common, is where you get Barrett's, which is quite serious. It is worth mentioning that, of course, you really have to have had reflux very bad for quite some time to get Barrett's, which is where the esophagus becomes more or less a stomach. And the cells, unfortunately, can get a little bit unstable and sometimes lead to cancer, which we're not going to talk a lot about today because it isn't a very common complication, but it is worth mentioning it. What clearly are the risk factors? Of course, anybody that's obviously suffering from suspected or confirmed reflux or GERD will always think, what can I do to make things better? What are the things I'm doing that are making it worse? And this is really very, very important. Makes sense if you are overweight and there's a lot of pressure in your abdomen, then of course the pressure can actually create that push up of the reflux or the acid or the bile. Smoking, clearly a risk factor. Having a hiatus hernia, which we will touch on a bit later in this presentation because of the importance, real importance of a hiatus hernia, which is really a hernia as we know it, but more around the diaphragm and its linkage with reflux. And that really requires special attention. So we will talk about that a little bit later. Of course, certain medications, understandably, can cause it. And of course, the important thing always with reflux, most times is actually, is it reflux or is it something else? And I think diagnosis is still, I think, sometimes a concern. Some patients are are always worried, is it reflux? And if it is, are they getting any damage? And I think when we look at a diagnosis, then normally the story can tell a lot, but occasionally we have to do cameras, and sometimes we have to do dye tests, and sometimes we have to look at acid levels in the esophagus. We may touch on a little bit later the relevance of that, because proving reflux with any shadow of doubt is absolutely critical if you're ever beginning to move in the trajectory of surgery, because there is no way that anything operative or surgical can be done if we are not certain that we're dealing with reflux. And because it's a common problem, of course, we don't want it to be mimicked or masquerading as another problem. So that's really very important to have a diagnosis confirmed, and that's why sometimes we have to actually measure the acid in the esophagus. So yes, hiatus hernia. Now, some of you may or may not have had a diagnosis of a hiatus hernia, but essentially it's where the diaphragm, the hole that is present in the diaphragm naturally as part of the way the body has been created or designed, is wider. It's wider than it should be. Unfortunately, that means that the stomach upper portion can move up and down into the chest. And that is unfortunately where reflux can be precipitated or can be caused by that simple change in pressure or change in position of the stomach and the esophagus, which is a hiatus hernia. And that is probably linked with a GORD or reflux, probably in about more than 40 to 50% of cases. And so it is important. Now, how do you make the diagnosis? With an endoscopy in most instances, but occasionally it can be picked up on a chest X-ray or a body scan, a CT scan or MRI scan. So it could be more of an incidental finding. But most times in clinic, with an endoscopy, it's quite simple to pick it up using an endoscopy, which is a camera into the mouth, looking down into the stomach and the gullet. And this is just an example on this image that just shows what the hiatus hernia looks like. The diaphragm, you can see, I don't know, yeah, the cursor, this is really the hole in the diaphragm, which is quite wide. This is the heart in the top here and the liver over here. And you can see the stomach has actually gone quite high up, and this is a problem. And this would potentially be what we would call a predisposing factor to reflux disease. So really going back to more or less the complications of reflux or GORD, and I've mentioned them earlier, but I think we'll just go back to them again. When there's inflammation, which is soreness or redness or irritation, then that can cause damage to the esophagus. And that usually is picked up with an endoscopy. As you look down, you'll see the redness, you'll see maybe some what we call erosions or some scarring. And that is very much diagnostic of reflux or GORD. Very diagnostic, frankly. You see that, you know that there is something that is irritating the lower part of the esophagus. Now, unfortunately, this is not treated, or if it persists for a very long time, as we all know, when the body heals, you tend to get scar tissue, and that scar tissue can lead to narrowing or strictures, which we call peptic or benign strictures. Now, they do cause blockage on occasion, and you might, or patients may experience difficulty swallowing certain things like solid foods like bread or meat. Now, the good news is that they are not the commonest causes of narrowing or stricturing of the esophagus, it must be said, but they can occur. As I highlighted earlier, Barrett's is a condition where there is a very abnormal change in the lining of the esophagus, usually as a result of long-standing reflux, untreated particularly, and that is a serious condition, partly because it can on occasion lead to cancer of the gullet or esophagus. So we take that very seriously indeed. But as I mentioned earlier, it is not a common or frequent complication of reflux that we see in usual instances. So it's certainly not something we like to maybe scare patients about, because it is certainly a rarity when it comes to overall reflux that we see in the population. As I mentioned earlier, cancer can obviously be a problem, and it's normally linked directly with reflux when it comes to GORD or reflux disease. On occasion, reflux can cause hoarseness of the voice, partly because, of course, as the acid lifts up into the esophagus, it goes higher into the neck and can trickle down into the voice box. And you do occasionally find, certainly, individuals who maybe are singers, they can get problems of low tone or loss of voice function, and that can be a bit of a problem when it comes to career. So yes, problems with the voice box can occur in reflux, and hoarseness is a recognized type of symptom of reflux disease. As I did highlight and mention earlier, on occasion you can get it in the lung and then get pneumonias, but that again isn't very particularly common, but can occur.